We're joined now by Dr. Reuben Warren, who is the director for the National Center for Bioethics in Research and Healthcare, and you're also going to be speaking at the closing general session. Can you tell us what your focus is going to be?
I will, but the National Bioethics Center is at Tuskegee University in Alabama, historical context. The closing session is going to be on health and justice, focusing on population health and social justice in my view. It tries to reconcile the difference between being sick and being healthy in this world.
And what about mass incarcerations? How have those shaped the health of the underserved populations, and what more needs to be done?
Well, I live in Alabama, and the chain gang started in Alabama. It was an effort to continue enslavement under a different title, and various ways of incarceration were then and continue now. So it changes its focus, but not its intent.
And how do we measure or track the progress in the work that we're doing towards addressing health inequities?
You measure the inequities by progress in not comparing one population to another, but looking at the progress in those who are most underserved. Comparing one to the other does not do anything. Look at the health status of a given population and look at the measure that improves their health status.
So what more needs to be done to get there?
A refocus on what's important, focusing on applying the science as opposed to generating new science. We know enough to do better, and we're not doing as well as we should.
What about critical partners in this sector? Who are those people that we need to be working with to dismantle those social structures that perpetuate inequities?
I think we need to focus on institutions and partnerships as opposed to individuals and partnerships. The old partners, as we know, you measure health outcomes by health disparities by education, employment, social justice, housing. So those are the old partners. New partners should include the faith community that has not been a focus as it should have been. Not the religious community per se, but those who know there's something bigger than them, and that's the faith tradition. So I think those are the new partners we need to engage. And it's renewing partnerships, because health really begins with kind of a spiritual foundation. So it's not anything that's new, we're just renewing what we already know.
Well, thank you so much for joining us, Dr. Warren. We appreciate it, and we look forward to your remarks in the closing session.
I'm excited about it. Thank you.